On the Frontline, proudly brought to you by UT Life Insurance.
Hello everyone and welcome to another edition of On the Frontline. I am Thomas Nadi Butselman. The outbreak of the deadly Ebola virus in February has claimed more than 1,000 lives. What started in Guinea has since spread to other West African countries like Liberia, Sierra Leone and Nigeria. The virus has proven to be the fastest spreading virus in recorded history. According to the World Health Organization, the virus is spreading faster than efforts to contain it. In today's edition of On the Frontline, I take a look at the deadly Ebola virus and its security implications in West Africa. The first known incidence of the Ebola virus occurred in 1976. Two simultaneous outbreaks in Zara in Sudan and Yambuku in Zaire, now Democratic Republic of Congo, were recorded. The name of the Ebola River near Yambuku was given to the new epidemic. Outbreaks have mainly occurred in remote villages in Central and West Africa, close to tropical rainforests. In the current outbreak, more than 1,000 people have died in West Africa, mainly in Guinea, Sierra Leone and Liberia. Even though the death rate is high, there are survivors. The World Health Organization described Ebola as one of the most virulent viral diseases known to mankind.
I am declaring the current outbreak of Ebola virus disease a public health emergency of international concern.
There are 5 distinct species of Ebola, and the survival rate ranges from 25 to 90%. The director of the Noguchi Memorial Institute for Medical Research explains the mode of action of the virus.
There are several types of viruses. This is one that they call filoviridae types of viruses. It includes Ebola, Marburg, other things. There are other big named viruses, but basically they are rod-like. They look, if you look under the microscope, electron microscope, they look like a rod, a thin rod coiled on itself, and it causes what is called hemorrhagic fever. So you call viral hemorrhagic fevers. Basically, it's from the way and manner the virus attacks the body. So after the initial symptoms, you're going to get bleeding, vomiting, diarrhea and things. And the bleeding is not just any small bleeding, but almost all parts of the body. So if you get a small cut, the blood doesn't clot, and you're just sort of wasting away bleeding. And so that is a type of virus, you could say, but it causes this fearful illness, which Ebola virus disease.
How is the Ebola virus transmitted?
At the moment, what we know is that fruit bats harbor the virus. So there are viruses or other types of let's say germs, which are part of various living organisms. So you may have something in you which does not cause disease. So they will say that's a natural host. So it stays there, it doesn't get disease. But when it gets to another host, let's say a monkey or a man, the body tries to fight it, and in the course of fighting it with the virus also multiplying and trying to survive, you get this illness, and then sometimes people die, or sometimes the body is able to overcome the virus. So the current thinking is that fruit bats may be the natural host of the thing, or the virus, and that bats may infect wild animals, including monkeys and things on the forest bed. And then if man comes into contact with those infected birds, wild animals, they get infected. What happens in the population is that when people become acutely ill and people are caring for them, then they also then transmit within the human population from man to man. But naturally, this lives in the wild animals and things. So it's something they call the zoonosis from animals to man. Zaire currently, Congo, there was a clear documentation of, I think, 2 children whose parents were sick from Ebola, and they were living in the same hut in the same village, and they recognized this, so they had these trained people taking care of the parents and told the children not to touch their parents because of the illness. But because they couldn't send them anywhere, they lived in the same hut for some days. The parents died, they buried them like they would bury Ebola patients, but the kids never got Ebola. So this is on the basis, some of the reasons why they say that you actually have to come into contact with people who are sick and are bleeding and the body fluids of people to get the illness.
Men who have recovered from the disease can still transmit the virus through their semen for up to 7 weeks after recovery from illness. The World Health Organization and the governments of Guinea, Liberia, and Sierra Leone are requesting financial support of about $71 million to implement the Ebola outbreak response plans and priority preparedness activities for the period of 6 months to accelerate the response in the region. The scale of the ongoing outbreak is unprecedented, with reports of more than 1,360 cases and 767 deaths in the 3 affected countries since March 2014. The Ministry of Health of Nigeria reported its first case of the Ebola virus on 27 July this year. National authorities in Nigeria are working closely with the World Health Organization and its partners to ensure that this case is contained at the source. The World Health Organization has also alerted neighboring countries about the outbreak, calling for intensive surveillance for any illness consistent with a viral hemorrhagic fever, especially along land borders. Ghana is currently testing travelers at the entry points to ensure that no one carries the virus into the country.
We are attempting something at the entry points, the legal entry points. We have our port officials there. The illegal points, we want to rely on the communities, to report all those who come in, the district assemblies could also support, and I am using the central region as an example. When the rumor came that the fisher folks were coming in canoes from Sierra Leone and Liberia, obviously the community was aware. When somebody dies, immediately it was a false alarm, but at least our people got in, so the information came from the community, and that route was not approved route. canoes come in every time to the shore, but immediately the community knew they were coming from Sierra Leone and Liberia, so they reported. So in cases like this, we will rely on the community, but the approved entry points, I think we have port officials who are screening to know those who are coming from countries that will need to take a second look.
We now pause for a short breather. When we return, we will focus our attention on Ghana's preparedness to fight the deadly Ebola virus in the event of a possible outbreak. We will also explore the security implications of the spread of the deadly virus in the West African sub-region. Health workers in Ghana have raised concerns about their safety in the event of an outbreak of the disease. Ghana needs an amount of about 10 million Ghana cedis to effectively prepare for any potential outbreak of the disease. But government has so far allocated an amount of 6 million Ghana cedis to procure 10,000 protective gears for frontline workers in health, immigration and other agencies who are mostly likely to encounter a possible victim.
We need a lot of money. Actually, our budget to be beyond 10 million. Beyond. The reason is that now that we are talking about Ebola, we are looking at PPEs, personal protective equipment, which are expensive. So we are looking for that one. We're going to procure them. We are looking at isolation units. They may not necessarily be in the hospital, or cocoa shed, social center, whatever isolation is, which we have to equip. So for anybody who can give tents, so forth. So we are looking for that. We are now also putting a lot of emphasis on personal infection prevention in our facilities, frontline staff in the villages, in hospitals, districts. We are making sure, so there will be a lot of use of gloves, yes, and protective clothing, and then that one, and there will be profuse in also using disinfectants, which we need to buy. The immigration have also hinted that now that they also, unapproved, there are so many of them, they've deployed their staff there, and they will need a lot of gloves. We need, it was suggested that then they should be going around the border, which means we need motorbikes and so forth to be able to patrol all those things. And then the Gucci, which is doing the investigation, will also need the reagents. They are very expensive. The WHO has promised that, but you know that people work throughout the whole night in trying to get the things done. They do that.
Ebola outbreaks have occurred in Africa on more than 24 occasions over the past 40 years, and they were brought under control every time. This was possible because of reliable techniques such as preventing direct contact with infected persons and monitoring all people who did come into contact with an infected person. Anyone showing early symptoms was put in isolation. Despite no effective treatment or vaccine, these standard approaches worked. Unfortunately, today's outbreak is different. Unless there is more investment to fight it and a coordinated response across countries, the outbreak will spread further. If that happens, economic and political chaos could follow. This could threaten the peace and security of West Africa.
The pandemic, the disease in itself, creates a certain level of anxiety and fear that is at very high levels, which in itself creates a security problem. And so, when you are trying to contain the disease, how you also deal with the security dimension is important, because if you are not very efficient in the coordination of security, that is precisely where the type of fear and panic that becomes widespread makes it very difficult for health officials to be able to deal with it. Let me quickly give you a narration of Patrick Sawyer. Patrick Sawyer is the American Liberian who works with a mining company in Liberia. but he seconded to the Ministry of Finance. Patrick's sister contracted the Ebola disease, and Patrick obviously went into contact with his sister. His own company knew about this, so Patrick was immediately exempted from duty and never to even report to the premises of the company. Because of the security breach, however, the ministry he was seconded to, which is the finance ministry, cleared him to represent Liberia in an ECOWAS meeting in Calabar. Patrick goes to the airport in Monrovia. The health officials did not know that Patrick, who was under surveillance as one of the people on their list, was asked to represent the government of Liberia. So in other words, his company knew, the Ministry of Finance is seconded to did not know. The health ministry knew, but the health ministry did not know that he was traveling. In the airport of Monrovia, he was literally lying on the floor. None of the immigration officers bothered to find out why is somebody traveling in that type of pain and agony. To cut the long story short, he boards a plane, arrives in Lagos. And as we speak, the spread of Ebola to Nigeria is not because the disease spread, but because the security dimension of coordination and containment was glossed over. He carried it to Nigeria. In other words, if security in terms of not just surveillance health-wise, but coordination to ensure that people who are being surveyed or under surveillance are not moving and intermingling with people. If that was effective in Liberia, Nigeria would never have had Ebola. And so you have a dysfunctional institution at state level in Liberia that has cost West Africa much more, and directly Nigeria.
What are some of the lessons we can learn as a country from the Nigerian experience?
We should give credit to the Nigerians for the way and manner they promptly rallied around to respond to the Ebola scare. In fact, I made a joke the other day that if the Nigerians had responded to Boko Haram, just like they have done to Ebola, they will not have the Boko Haram continuously a threat to them as it is today. But putting that aside, you see, a doctor insisted that Patrick should not continue to Calabar. And that saved Nigeria also in a way. Because the doctor kept on monitoring the temperature and getting alarmed at the consistency and asking questions about, you cannot be traveling with this type of temperature measure. And being suspicious of where Patrick came from, though he could not imagine Patrick would have Ebola, but the suspicion in itself saved the situation. And don't forget that doctor died. And now, immediately, they tried to isolate Patrick with all the contingency measures because they were never prepared for it. So, at the level of the state in Lagos and at the level of the federal government, I thought that they rallied around promptly. Second lesson, Lagos State is governed by the APC. And at the federal level, which is the national level, you know, President Jonathan is from the PDP. But they were able to put their political competition and differences aside because the threat was to Nigeria. And it was not about who belongs to which political party. So when there is a crisis that afflicts a nation, people must rally to respond as a people and not continuously be walloping and undermining one another on the basis of political differences. And so to that, we give the Nigerians another credit for the type of rally. But immediately, they then tried to create an isolation ward with 40 beds in Yaba Hospital. They tried immediately to engage with doctors who must be on standby. Yes, there were doctors on strike, but what leadership did was to be very assertive. In this national crisis, stop talking about what is your interest and let's rally around and deal with this. And afterwards, we can talk about your grievances. Those who refused, dismissed. So there were clear messages that this is a national crisis with a huge security dimension, and we're not going to be messing around. Now, the point here we must learn at a second level, at a third level, is that when you are confronted with a national crisis, you operate with an extraordinary response. And so in Ghana, when people started questioning why government should propose and postpone the reopening of universities, they are not aware of the enormity of the crisis that is staring us in the face. Because at that level, your autonomy and your independence ceases. It is about life, and government has the responsibility to protect people and save lives.
What is different about this outbreak is that the Ebola virus has not changed, but Africa has changed. Residents of the affected countries travel further and have many more contacts than they did in previous decades. Following up on all contacts who live a few miles from a case is easier than tracking down people who may live far away. With modern transportation, family members may travel hundreds of miles to be with sick loved ones. Some people in Ghana have an idea about the mode of transmission of the disease.
I've heard Ebola can be transmitted through body fluids like the saliva, sweat and all that, and it works on your immune system just as HIV virus does. And that's all, but my fear is that in Africa it will be very hard for us to fight this because of our temperature. We are always sweating, and that is my problem, because you easily get in contact with human fluids in Africa than any other of the continents.
The disease is very difficult to say you are going to have a personal precaution on, but as much as you can, if you can have a sanitizer in your pocket anytime you greet someone, you use the hand sanitizer, you have regular wash of hands with soap, because a lot of us wash our hands without using soap. So using soap to wash your hands regularly and having a hand sanitizer, I think that is, since it's not airborne, I think that is a better way of preventing it. Aside that, I think there's very little you can do.
I was assured by the organization that brought us over here that we would be good, so I just took their advice and we talked to the Ghanaian consulate and we wipe our hands a lot, and here we are. And so my suggestion to everybody is just wipe your hands.
The Ghana Health Service is stepping up efforts to educate people about the disease.
We're going to put posters all over the world so that people will know about it. And we also target some group of people. We know that the traditional leaders, they can, when they understand, especially those at the coast, they will then help us a lot. We also know the religious leaders, the churches and the mosque, for them when they get the right message, they're able to convince their people. We've already made education service and they're giving some copy to them, so they'll be sending to the schools. So there are a lot of series of meetings and then circulating data.
There is no licensed vaccine for Ebola. Several vaccines are being tested, but none have been approved for clinical use. One of the untested drugs, Zimab, has been used on 2 American missionaries who are said to be improving. It was also given to a Spanish priest who later died. Its effectiveness is unknown, but the World Health Organization has ruled its use ethical in the circumstances.
There was unanimous agreement among the experts that in the special circumstances of this Ebola outbreak, it is ethical to offer unregistered interventions as potential treatments or prevention. It is very important to not give false hope to anybody that Ebola can be treated now. This is absolutely not the case. What we rely on now is proper implementation of infection prevention and control tracing, quarantining of people who have the disease, quarantining of contact to make sure that they would be under proper treatment if they indeed develop the disease. Limitation of movements of people in and out of the zones which are the most infected. These are the measures right now which are likely to make a difference, and we hope we'll be able to stop this outbreak.
stocks of ZMapp, which was developed by an American pharmaceutical company, have been sent to the affected areas. The company says it has given the treatment free of charge. Canada has also sent about 1,000 doses of an experimental drug developed by government laboratories. It has previously shown promising results in animals but has never been tested on humans. For now, Ebola continues to spread. In terms of preparedness, do you think Ghana as a country, we are prepared enough to confront any potential outbreak of Ebola?
If you want to be effective, let people be prepared against your benchmarks for security coordination. What you need to do is to clearly set up your parameters and educate the people to know that if this were to happen, this will be our response. So if we hear that there is a confirmed case in area A, this will be our response. But if we hear that the confirmed case resulted in a death, this will be the second level of response. If we hear that the layer of death has even increased to 2 or 3, this will be the nature of the response. In that way, the public is already educated preemptively in waiting. It becomes easy to engage should it begin to happen. But what is happening now is that at the level of the engagement health-wise, I think an excellent work has been done. But at the level of the security coordination, I think a little needs to be added. Over the weekend, WANEP monitored one border, the Aflao border. We're amazed that on the Togo side, there is nothing you can see as an indication of preparedness to fight Ebola. But on the Ghana side, it's our immigration officers who are wearing gloves, who are wearing masks and talking and trying to be careful and etc. The question is, it doesn't matter what we do on the Ghana side. If the Togo side is so relaxed and unprepared, we are in the same danger of being exposed as they are. And so if I had my way, our health authorities should be making phone calls. Hey, this is what we are trying to do. And what we are seeing across doesn't seem to resonate with our thinking. What is happening? It's our right. So that at the end of the day, collective effort and response prevails, rather than one country doing everything possible and the other not simply bothered. Because then that dysfunctionality would cost all of us.
See you same time next week for another edition of On the Frontline. I am Thomas Nadi Betini.
On the Frontline, proudly brought to you by UT Life Insurance.